41 years old and who is morbid obese. He is 120 kg in weight, and he presented with 12 hours of chest pain, and on ECG there was an evolved anterior wall ST elevation MI, and on echo there was a RWM in LAD territory with moderate LV dysfunction. And this is the after obtaining all the clearance, we proceeded for the angiography, and this is angiography iliacaudal view, and you can clearly see there is a near total occlusion in the LAD, in the diagonal also, and in ramus there is a non-significant lesion. And this is a cranial view, and you can see clearly there is a across the diagonal there is a near total occlusion, almost 98-99% stenotic thrombotic stenosis in the LAD, and ostial diagonal also is almost 99% thrombotic stenosis. So after obtaining the all clearances, we went ahead, proceeded for the angioplasty. This is the right radial root, and this is a EBU catheter, sorry, XB catheter. So in such cases, there should be a plan of bifurcation in ostial diagonal, and but you see the diagonal diameter is almost 2 to maximum 2.25. so what I decided is to do the provisional in the LAD, and if something happens then, so in this still frame you can see the LAD near the arrow, almost near total occlusion with diagonal is a small vessel, is almost 2 to 2.25. So we decided to do provisional angioplasty in the LAD, and then NC just like pot. So I parked one wire in the diagonal and one wire in the LAD, and did predilatation in the LAD. And after predilatation, we went ahead with the 3x24 stent, you can see, which inflated at around 12 atmospheric pressure, 16 was RBP, nominal was 8, and then did the NC. Now till this time everything went well, and you can see the one wire is in the diagonal, and the diagonal was like same, there was no compromise of the diagonal, and that wire got gelled now. LAD is good flowing and everything went well. And at this point I was trying to pull the gelled wire, but it was very difficult to come out. So you can see I'm trying to get this diagonal wire out, which was a gelled wire. You can see in this scene the gelled wire was not coming out, it was giving me a resistance. So I have given some NTG and everything, and then somehow I managed to pull out the gelled wire. You can see in this frame, you can see the gelled wire is coming out, and you can see the progression of the catheter inside the LAD while removing this diagonal gelled wire. So it was difficult, but we managed to get it out. And now you can see the LAD, and diagonal is also flowing well, just like before. This is a without wire shot, and it's a young patient, 31 years old with morbid obesity, 120 kg weight.